Imagine a virus that can start like a regular flu, fever, fatigue, body aches, and then, in some people, it can rapidly turn into severe pneumonia or even inflammation of the brain. That virus is Nipah. It's not a new virus, but it's back in the news in late 2025 and early 2026, and people are asking the same question: is this the next pandemic? In this video, we'll break it down calmly and clearly: what's happening right now, what Nipah is, how it spreads, what symptoms matter, how it's diagnosed, what prevention actually works, and how realistic a pandemic scenario is. Current update. What's happening now? Here's the latest as of January 28, 2026. There are 2 confirmed Nipah cases reported in the Indian state of West Bengal, identified since December 2025. Authorities said the situation is under control. About 196 contacts were traced, monitored, and tested, and no additional cases were confirmed among those contacts. Because Nipah has a reputation for high severity, some places increased health screening at airports and borders. That's a standard public health response when a high-risk pathogen appears. The key point: right now, this looks like a localized situation, not widespread global spread. What the virus is. Nipah is a zoonotic virus, meaning it can jump from animals to humans. Its natural reservoir is believed to be fruit bats, also called flying foxes. Why do health experts take Nipah seriously? 2 reasons. First, it can cause severe disease. Second, across past outbreaks, reported fatality rates have been roughly 40% to 75%, depending on the outbreak and the level of medical care available. The incubation period is usually 4 to 14 days, but some reports describe it lasting up to 45 days, which is why contact monitoring can extend for weeks. How it spreads. Nipah doesn't have just one transmission route. Think of it as 3 main pathways. Pathway 1, bat to human through food. In Bangladesh, outbreaks have been linked to raw date palm sap, which can be contaminated by bat secretions. Pathway 2, bat to animals to humans. A historical example is pigs acting as an amplifier host during the Malaysia outbreak. Pathway 3, human to human, usually through close contact. Person-to-person spread can happen, especially when caring for someone at home or in a hospital without proper protection. But here's the crucial detail: Nipah is not known for easy, consistent spread between people the way influenza is. That's one reason outbreaks often remain limited and local. Symptoms. Early on, Nipah can look like many everyday infections: fever, fatigue, headache, muscle aches. From there, it can move in 2 dangerous directions. First, respiratory disease: cough, shortness of breath, and in severe cases, pneumonia. Second, neurologic disease: encephalitis. Warning signs include unusual drowsiness, confusion, seizures, and rapid worsening. Some survivors can have neurological after effects, and rare reports describe late or relapsing encephalitis later on. Diagnosis. Nipah is confirmed with laboratory testing. Most commonly, this includes RT-PCR in the acute phase and serology, ELISA, to detect antibodies. In real life, the key question is when to suspect it. Suspicion rises when you see severe respiratory illness or signs of encephalitis, plus an exposure history, such as being in an affected area or having close contact with a suspected or confirmed case. When that combination is present, clinicians follow local public health protocols for testing, isolation, and contact tracing. Prevention. Prevention is practical and focused on reducing exposure. In regions where it's linked to outbreaks, avoid raw date palm sap, especially where public health warnings are active. Wash fruit and avoid fruit that looks contaminated. Practice hand hygiene, especially after contact with animals, farms, or markets. In an outbreak zone, avoid close contact with people who have fever or cough, especially if neurological symptoms are involved. What medicine can and can't do today? As of now, there is no licensed vaccine and no specific medication guaranteed to cure Nipah. Treatment is mainly supportive care, supporting breathing, managing complications, and intensive monitoring. Vaccine research is moving forward. In late 2025, Oxford, supported by CEPI, launched a Phase 2 trial of a vaccine candidate called ChAdOx1 Nipah B in Bangladesh, and there's discussion of keeping reserve doses for emergency use during future outbreaks. Pandemic risk. So, could Nipah become a pandemic? Two facts matter most. Fact 1. Nipah is genuinely dangerous, and global health agencies consider it a priority pathogen because of its severity and potential threat. Fact 2. Nipah does not show stable, easy person-to-person transmission. Spread usually requires close contact, and chains of transmission tend to be limited, especially when public health measures are activated quickly. Isolation, contact tracing, and monitoring. That's why the current situation, 2 cases, aggressive contact tracing, and no additional confirmations among tracked contacts, points to localized containment, not runaway spread. The bottom line? There's no reason for panic, but there is a reason to take it seriously as a reminder that zoonotic outbreaks will keep happening, and fast detection and response are what prevent wider spread. If you'd like, I can make a follow-up video. How to recognize encephalitis red flags versus a routine viral illness, without fear-mongering, just a clear action plan. Subscribe if that would be useful, and share this video with someone who needs a calm, factual explanation.